X-ration for Emily Johnson. It is the 7:30 shift. She is she has an ear infection and diabetes, and she needs a flu shot. The orders from the physician on the orders, the patient is going to receive a flu shot, Fluzone, 0.5 mL IM now in the deltoid. She will get today. She will get Humulin N sub-Q, and she will also get Ovafloxacin or Floxacin ear drops in the affected ear for her earache twice a day for 7 days. The patient's name on the MAR is Emily Johnson, and on the orders is Emily Johnson. The date of birth is 12/16/XXX on the MAR and 12/16/XXX on the physician orders. Her MRN is 36180, 6612 on the MAR and on the orders. She has allergies to morphine and codeine.
200 milliliters per hour. That's it, 30 milligrams.
I'm going to get her medication.
200 mLs per hour.
I have Ovafloxacin. 1 drop equals 1 dose. Expires 12/31/60. I have the influenza vaccine Fluzone. It's 0.5 milliliters per dose. Expires 12/30/2050. And Humulin N. 15 units. This is 100 units. Expires 12/20/2050. I'm going to get my things together here. So, again, I have my influenza Fluzone vaccine, 0.5 milliliters per dose. Patient gets 0.5 milliliters. The expiration is 12/30/2050. I have my Humulin recombinant, and the expiration is 12/20/2050. This has 100 units. She's going to get 15 units sub-Q. And then Ovafloxacin or Floxacin, 1 drop equals 1 dose. It expires 20/31 and
Okay,
2060. I'm
I'm
going to do my med math.
It's going to help with the GI discomfort that you can have in the nausea and vomiting.
So,
Get started over about 30 minutes. Then I would sign off with
0.5 milliliters equals 1 dose. And this is 0.5 milliliters. So it's 1 dose. 0.5 milliliters equals 1 dose.
Every 4 hours.
So
She's not had it
it
yet.
is 0.5
Given
milliliters
for a pain of 8 out of 10 in your back. And I'm going to give
equals
it
1
the
dose.
deltoid. This is something that doesn't matter which arm you
And
give
then
this to.
for
No?
the
Okay,
Humulin,
great. We'll
it
go
is
ahead and do this
15
left arm then.
units.
So, and then I have the mLs.
This is 100 units.
0.4 mLs. 0.4 mLs.
She's going to get 15 units.
Find the
15
acromion
units.
process
They're provided
with my non-dominant
100
hand.
units. and she's gonna get 15 units. The drops, she has one drop equals one dose, and she's gonna get 2 drops, so she's gonna get 2 drops or 2 doses. 1 drop, 1 dose, 2 drops, 1 equals 2 drops or 2 doses. Okay, she is allergic to morphine and codeine, and I am gonna check in the handbook just to make sure that these do not go against what she's getting. And my drug book.
Next, we'll move on to the insulin. I'll do my final med check. I have Nicolog insulin. Blood sugar is 244. So our sliding scale calls for 6 units. For our blood sugar between 241 and 300. This is also just one moment. I'm going to grab another alcohol swab.
It doesn't have any information on any reason that she could not get it, because it's not anything to do with morphine or codeine. Get insulin.
Okay, sorry about that.
Is for diabetes. It doesn't have any contraindications
Okay, do you
for
normally take your insulin in
taking
your
it
belt?
with
Yes,
any of these
alright.
other meds, and
Alright,
no
does it matter
morphine or
which side we go on?
codeine, sorry.
Okay, it looks like over here on your left, best. So the doctor called for 6 units, Novolog insulin.
And I don't see anything on the flu vaccine. Alright, so I'm going to get my supplies together. I need to drop my medication.
And then do routine.
I'm going to start with the insulin. So she gets 15 units.
Go ahead and sign off my morning insulin.
Clean for 15 seconds.
Mrs. Wilson, can I get you anything to eat or drink? Your breakfast should be coming shortly. Are you more comfortable now? Can you tell me if your pain has gotten any better? And rated on a scale of 1 to 10? Okay, she says her pain is now at a 5. I will be back to check on you shortly. I will make sure she has her call bell, complete my, and come back and complete my, head to toe assessment. Make sure her bed's to the floor, that she's safe, wired, computer out of the way.
I will put my name, med name, which is me. And 15 units at 7:30. And
I think it's so easy, I couldn't remember what to write down.
do the flu vaccine. He will get 0.5 milliliters. And that's for 15 seconds.
She left her. Oh, that's weird. You know what? I think she got through that already to oh, she threw it. Yeah, I wouldn't say her anything, but yeah, I think she, or maybe she has it already. Maybe she's got it in her pocket. Yeah, I hope so.
No bubbles.
Alright, so you ask her about that. Let me get this. Oh, no, don't do that. It's okay. She has it. In her pocket.
This is Fluzone, 0.5 milliliters. My initials, today's date, and then I would have a second nurse check my insulin to make sure that I have drawn up the appropriate amount for the patient. Also, we're going to just put 2 drops in the ear. I'm going to get some extra gauze just in case there's cerumen in her ear. I'm going to take all of my things with me to the patient's room.
Have stuff in my pocket?
Oh, did I thought Hi, Ms. Johnson. My name's Shannon. I'm going to be your nurse this afternoon. I need to give you some medications, your insulin for your blood sugar control, a flu vaccine that will go into your arm, and the insulin, if it's okay, I'd like to put it in your abdomen. Is that where you normally do it? Okay. And then I also have some eardrops to put into your ear because of your ear infection. Is that okay? Great. So I'm going to check my medication. So I have my Fluzone, 0.5 milliliter.
I have the clear cap.
I have my Humulin N, 15 units. I have my eardrops, that I'm going to give you 2 drops in one of your ears. And
You don't need that.
I believe that your ear is going to be, it's your left ear, so we'll put those in your left ear. So let me just verify your name and date of birth. Your name is Emily Johnson. Emily Johnson on the MAR and Emily Johnson on the orders. Your date of birth is 12/16/XXX. Your date of birth is 12/16/XXX on the MAR, 12/16/XXX on the orders. And your medical record number is 361-806612, 361-80666812, 806612, 806612. All right. Are you having any pain right now? Your ear's bugging you? Hopefully this will help. All right. so let's do the insulin first and get that out of the way. I'm going to get it in your abdomen. Where did you get your insulin last? So you got it on the right side. We'll give it on the left.
The patient name is William Newman.
I'm going to measure 3 fingers away from the umbilicus and pinch enough tissue to get subcutaneous. I will clean the site for 15 seconds. All right, and then we'll let it dry. I have my insulin here. I'm going to inject it at a 90-degree angle. And we're not going to rub the site. She doesn't want a Band-Aid on it. And the skin there was fine. Skin integrity was good. There were no lesions, lumps, or bumps. I checked that before I gave the injection. And now we're going to give your flu shot. It's going to go, he wants it to be in your deltoid site. So we're going to give it in your right arm. The skin has good integrity, no lumps, bumps, redness, or swelling. It is intact. So we're going to go 3 fingers below the acromion process. I'm going to give it right here in the deep part of the muscle. Clean the site for 15 seconds. All right, we'll let it air dry. So I have my medication here, Fluzone. I'm going to do the Z-Track method. I'm going to put the plumber process of my hand, displace the skin, and I'm going to inject like a dart. We'll inject the medication. And we'll wait 10 seconds.
The second one is insulin, which I will
and then we'll pull that out and let the skin go back. Get rid of that. And I need to lower the head of the bed so that I can get in your ear comfortably. I'm going to turn you on your side. And I'm going to put this in your ear, just making sure there's no cerumen or anything blocking the ear. The ear skin integrity is good, no redness, lumps, bumps, or swelling. And I have my ofloxacin. We're going to give you 2 drops in the affected ear. And we'll count 1 drop, and then 2nd drop, and then I'm going to, oh, I forgot, I need to pull the pin back. We'll pull that, go ahead and pull that back so that we can make sure the medicine goes all the way in. Okay, and then I'm going to massage the tragus a little bit, just to make sure it gets all the way in there. Okay, and put you back on your back, and we'll sit you back up. There we go. All right, so I'm going to come back in about half an hour to check on you, see if the ear pain is any better. What was your pain level? About a 5 out of 10? Okay. And then I'm going to go ahead and put a Band-Aid on this. It doesn't look like it needs it, but we'll go ahead and make sure that we put a Band-Aid where we gave your injection here. All right. Do you have any questions for me about your medication? Excellent. All right, well, I will see you in about 30 minutes. So I will clean up my mess, wash my hands, and document what I gave to the patient, the time I gave it to the patient, the site of the injections, and how everything was tolerated. And I will go back in 30 minutes and assess the patient for how how she's doing now comparatively with pain.